Are you a runner who suffers with shin pain and it's driving you crazy? Feels like it's never going to get better. You've tried rest, you've tried new shoes, you've tried stretches, and nothing's getting better. I'm going to show you 3 of the best ways to start making progress when you have shin pain from running. My name's Ed. I specialize in treating running injuries in my clinic in Southwest London, and we've been going since 2015. So let's get started. What is shin pain and why is it so common amongst runners? Shin pain can be caused by lots of different things, but classically it would be something that we call MTSS, so medial tibial stress syndrome. And that is, on the lower end of the spectrum is where periosteum is irritated. Now, if I give you some anatomy lesson, you think about a crunchy. Now, in the UK, we call them crunchies. I'm not sure what they call them anywhere else in the world, but crunchy in the middle is like the bone marrow, and then the chocolate on the outside is periosteum. Periosteum, the chocolate, is the hard casing, and that's where the strength and kind of stiffness come from, and that's the kind of hard outer shell. The bone marrow is in the middle, and that's what creates extra bone and all sorts of other things as well. So when we have medial tibial stress syndrome, it's where the periosteum is getting irritated, often where tendon attaches into the bone. Sometimes it can be the tibialis posterior. There's some studies that show the flexor hallucis longus tendon can be irritated as well, which is where the kind of toe muscles. There's different types, but that would be at the sort of lower end of the scale. And through the different kind of stages of MTSS, we could get all the way up to having kind of bone marrow edema, and all the way up to a stress fracture where there's actually going to be a bone break. So it is classified as a bone stress injury. And that's really important for something that we'll go through later on. The first thing to consider when we're treating medial tibial stress syndrome in runners is the decision to run or not to run. Now, I've been on more courses than I care to remember about the treatment of running injuries from world-renowned experts. I've read a lot of content, I've read a lot of textbooks, a lot of studies, and I haven't found anyone or any study that shows not running when we have pain as being a bad idea. So I haven't found anything that moves away from the idea that if we are getting pain whilst running, then we need to stop running. And that's because we've got a bone stress injury. We need to optimize the bone healing, bone settling down, and we can't do that if we're generating pain from running. Pain generated from running is interrupting the healing process of a bone stress injury. So therefore, you may be able to run, but the problem won't get better. And often we describe it as like the sort of short-term pain for long-term gain. Obviously, you'd rather not stop running, but you'd also rather not have shin pain. And in the long term, we see people getting back to running, not having issues, and enjoying running again. The people who want to carry on and don't follow our advice don't get better and carry on running with pain. So they have limits to how much they can run, and it becomes more of a chronic issue. There is a lot of utility, there is a lot of benefit from not running whilst we have a shin pain, medial tibial stress syndrome presentation. And that's where we get our patients to do cross training, cycling, rowing, swimming. We get them to choose whatever heart rate they wanted to hit. If they were doing a run, if it would be like a zone 2 kind of easy pace, then for me, that would be kind of 145 beats per minute. And I would do that on a bike cross trainer. If I was going to be doing a more intense session, then that would be reflected in a different heart rate that I wanted to hit. So we need the bone to remodel. We need to allow and optimize that process. And that's where time out of running is frustrating, but necessary. The next most important thing when we're treating medial tibial stress syndrome, using rehabilitation. I've used this in many other videos before. If we think about the maximum capacity that the shin can tolerate is here. And if you're running and it hurts, then that maximum capacity is getting exceeded by the running. So walking down the street, your shin can tolerate, so it doesn't hurt. And that's potentially where the maximum you need, or the shin needs to be able to tolerate, is down here. When we're running and we're getting pain, the amount the shin can tolerate and the amount you're asking the shin to do for running is too much. So what we need to do is bridge the gap. So we need to increase how much the shin can tolerate to a level where we can run comfortably and it's well within the shin's limits, and even maybe go beyond that as well, so that we don't have a problem coming back. How do we do that? Rehabilitation is probably the most important way to do that. Now, we can use strength training. That would be things like heavy, slow resistance, so some calf raises, loading of some of the proximal tissues. There's some studies to link weak gluteus medius and maximus as a risk factor for shin pain. So we want to get those glutes nice and strong. That might be doing things like step ups, or it might be doing things like side planks. Later on down the treatment, we can also promote bone healing through using plyometrics. So we can use plyometrics to trigger a faster response in terms of bone healing through the vibration that we get from plyometrics. And there's a good amount of research to show that that's helpful as well. And plyometrics is where we're using jumping based movements, and the vibrations that we kind of send through the bone trigger a healing response, basically, and also prepare the bone for what it needs to do when you run. There's obviously lots of other types of strength training, rehab things that we would do, which I'll go through in another video, but they're the kind of ballpark types of things that we'd be looking to do for our runners with shin pain. And the third most effective way to get rid of shin pain when we're treating it is think about running technique as well. Now, the research for this isn't as strong as, let's say, rehabilitation and treatment room, and anecdotally, when we're doing things like increasing running cadence, so the steps per minute, when someone's returning back to running, we've done all the tests, so we're happy and confident that they're ready to go back to running, and increasing the cadence can be quite a nice way to reduce the pressure through the shin, make the calf do more of the work, and start to reduce something like an overstride, for example. So for example, if the foot lands ahead of the center of mass when you're running, that would be where the shin is going to take a bit more load. They're the kind of things that we can do to try and reduce the pressure through the shin. Something that we would definitely want to check and want to kind of implement as well. There's lots of research to show that making the calf do more is more economical and is actually better in terms of when we're recovering from shin pain. Now I'm going to give you a bonus tip here, which is around diet and body mass index. One of the risk factors for medial tibial stress syndrome is a high BMI. It doesn't mean you have to lose weight. It doesn't mean that you're just not cut out to be a runner. It just means you need to be able to make sure you're going through all the steps that we talked about earlier. The other one is dietary as well. So I'm not a dietitian, but we've spoke to lots of sports doctors, and it's something that they talk about a lot, and we believe is to be very important. In particular, vitamin D and calcium. So vitamin D, obviously, we get from eating things like peas and kind of different types of foods, and from being in sunlight. We had one sports doctor said that everyone in London is vitamin D deficient because we spend most of the time inside. So it's worth speaking to a doctor, getting your kind of blood checked to see if that is the case for you, checking your calcium intake as well. It's quite common that we find people are not eating enough calcium and not consuming enough calcium, and that can be a reason why further stress injuries can start to be more of a risk factor as well. There's more that we can talk about on this topic, but for now, that's what we'll stop with. If you have any questions about shin pain or how we treat it at Instant Physio, then please leave a question in the comments box. Thank you.